Was it a hard decision? No, most definitely. But I just felt that it was time. You know, this community has meant everything to me for the last 23 years. There's a lot of sweat, there's a lot of blood, there's a lot of tears in this community for what we've done over the years. And I think this community deserves the best person in this position that it can actually have. And by me stepping away, you know, we can quickly look for that next person to kind of fill that void and to continue just the good work that this community has to offer and this department has to offer. When I first came in as health commissioner, I really wanted to focus in on childhood health. But there were a lot of issues those first couple years, whether it was a budgetary concern that we had to fix. You know, we had a clinic here for a while, and that, you know, unfortunately just wasn't panning out for us. So there's some things we had to fix, but, you know, we got to a point where I felt very comfortable to be able to move on. And in 2020, we were supposed to move on a lot of these issues and fix some things. Well, as we all know, over the last 3 years, it's been hard to even move, let alone fix things. COVID-19, it really, I think, galvanized what public health was about, what it could do, especially this department. This department really, truly was prepared better than the federal government. I'd like to say better than the state government as well, too, to be able to handle issues. The problem is those resources that, you know, those two other entities have, we just don't have. You know, and I think we found out, too, you know, we made some great decisions. We made some decisions that probably weren't as great. We didn't know about this disease. We didn't understand it. It was a novel virus. We didn't know how it was going to act, and people did die from it. It's not like, you know, it was the common cold. The last 3 years, I've enjoyed it in the sense of I've got to talk to so many people in this community. You know, the elected officials were fantastic. The hospitals were amazing. Built some great relationships, some good partnerships. So I think that was the best thing about COVID-19 is just the ability for this community to respond as a cohesive unit. Yeah, we fractured every now and then, but for the most part, we responded very well. Over the last, let's say, 6 months or so, maybe a little bit longer, we've been able to secure some funding. We've been able to, I think, come out of COVID and start doing some of the things we wanted to do so many years ago and put those in place. One, I really hope when I'm gone that we continue looking at our children's health in this community. It is the thing that's going to improve our health in the community. It's not going to be you or I, the adults, if you would, and changing those behaviors that we can change. It's really starting those behaviors early on and even before preconception. So again, I think we're very well set for that. I think the community's engaged. Workforce development, you know, trying to retain good public health people as well as academic public health. Again, we cannot continue public health at a high degree unless we team up with academia, get some research dollars in here, get some other dollars in here to fix some of these problems that we have in the community. Again, be that partner in the community that we so desperately need to be able to solve public health issues. We have a very good staff, so I don't think that we're going to miss a beat. Matter of fact, I know we're not going to miss a beat. The idea here is public health is for this community. We don't look at the individual, we look at the entire community, and sometimes the community forgets about that. But we do have to help that individual so that it can be a better community. It's a tightrope they have to walk, but this department will do it. To this community, you do not know how good we have it here relative to all the different entities and organizations and community involvement groups. There's a lot here to offer, and I think we often forget about that. It's a hidden gem for the state. When we talk about Lucas County, it's not, or Toledo, it's not one of the big C's, Cleveland, Clemens, or Cincinnati, but we have a lot to offer, and you know we have to build on that. We have to build on our ability to get good paying jobs, continue to educate kids, making sure that, again, we have the highest amount of health in the community. You do that by, again, having good paying jobs, having good education, doing those things in the community to make sure that people can pull themselves up and make sure that they stay healthy.